Some patients desire to use their own tissue to restore a breast following mastectomy, and our preference is the DIEP flap using tissue from the lower abdomen. The DIEP flap stands for Deep Inferior Epigastric Artery Perforator Flap, which is an acronym to describe the blood vessel supplying the tissue from the belly. In essence, what it is a tummy tuck to provide breast mound reconstruction. In the past, patients underwent a similar procedure called a tram flap. A tram flap involved taking the whole muscle from the belly, so patients had higher pain, hernia, and that technique has fallen out of favor. The DIEP flap allows us as surgeons to reconstruct the breast mound using your own tissue, mainly your fat, from the belly to create a breast that's soft, natural, has blood supply just like your natural breast, and will grow with you as you age. The advantage of the DIEP flap over older techniques such as the tram flap, we don't use the rectus abdominis or six-pack muscle to reconstruct the breast as was done before with older techniques such as the tram flap. The DIEP flap allows patients to have a natural reconstructed breast using fat from their own belly to restore a breast that will last, is soft, has blood flow, and will grow with you. Patients often ask, when can a DIEP flap be performed? Most commonly, we will perform this procedure at the time of the mastectomy, which is known as immediate reconstruction. However, when a patient has had previous mastectomy and radiation, it can be performed in a delayed fashion. Sometimes, if we know a patient's oncologic plan involves radiation therapy, we may place a temporary tissue expander as a place saver or spacer while the patient undergoes chemotherapy and radiation, and once this is complete, remove that spacer and place the patient's own belly tissue or DIEP flap. The DIEP flap is performed in a hospital setting, and most commonly patients stay for 2 to 3 days before being discharged home. Typical recovery after the DIEP flap is 4 to 6 weeks. Depending on the patient's abdominal fat, the tissue is used to reconstruct one or both breasts. If a patient desires to only have mastectomy on one breast, the DIEP flap procedure can be performed on one or both breasts depending on the amount of abdominal fat that a patient has. If a patient desires to have one breast removed and the abdominal fat is used to reconstruct that breast, it is very common for us to perform a breast lift on the opposite breast to provide optimal symmetry.